Brian Anderson here. I hope that you are doing well. Today we're going to be going over a couple of things, and we get this question a lot, the differences between PRP and prolotherapy. So you may have heard about either one of those or both, and both of those are injection-based techniques that we use for injury. And we love to use both, and there are certain situations where PRP might be advantageous over prolotherapy, and other cases, obviously, where prolotherapy might be a better tool than PRP. So both involve injection, and those injections usually are geared toward treating an injured body part or an injured site, or a site where we want to regenerate tissue, right? So both injections are used for different types of injury and different types of illness. So frequently I'll hear someone say, well, prolotherapy just didn't work on that body part, or PRP didn't work on that body part. And really it matters which technique and which tool you use to fix the injury, right? So you want to make sure you have the right technique or the right treatment for the right type of injury. So it's not a one size fits all, unfortunately. So let's talk about PRP, let's talk about what it is, then let's talk about prolotherapy, and then let's compare and contrast the two. So first off, PRP stands for platelet-rich plasma. And basically what platelet-rich plasma does is it has growth factors that are extracted from your bloodstream that are injected into an injury site. Now, we treat a lot of professional athletes, ex-professional athletes, weekend warriors, moms, dads, etc. And the healing rates for that type of treatment can vary, and it can vary based on nutritional factors, can vary based on age, can be vary based on your nutrition. How long have you had the injury, right? So how long an injury has been present can also play a role in how well your body responds to either type of injection. But PRP, coming back to that, platelet-rich plasma, basically how that is performed is a blood draw is done, typical standard blood draw. Then that blood is processed, and then from that blood is extracted the PRP, which is again the platelet-rich plasma. That PRP is then typically injected or used into the site of the injury or for regeneration and for healing. So that's PRP. Now let's contrast that with prolotherapy. Now prolotherapy involves injection of dextrose and usually lidocaine. And so lidocaine obviously is a numbing medication. That really doesn't do the healing, but the dextrose is super concentrated dextrose. Typically it's D50. And this is a concentrated sugar. Basically what the dextrose does, the way that it works is dextrose actually induces a micro-inflammatory response in the body where it is injected, which then can stimulate growth factors and healing of that area. Now, as you would imagine, some areas of the body have more blood flow than others. So PRP, I find, works very well for areas that have a high level of vascularity. And so certain joints have great blood flow, other joints, other tendons sometimes do not. So in a case where there is little blood flow anatomically to an injury site, let's say like an Achilles tendon, I typically would prefer using PRP. Now, obviously discuss any medical care, any medical treatment with your doctor before doing anything, right, to make sure it's the best fit for you. But there are certain areas of the body, definitely, that I find PRP will work better than prolotherapy, and then vice versa. There are some areas where I feel that prolotherapy helps patients get better results. So make sure when you're talking about these types of treatments that you're seeing a provider that is knowledgeable about both types of injections to determine what might be best in your situation, or if you should be looking at doing an injection-based treatment at all. So we also have established a post-op treatment program for patients that have gotten or received an injury. treatment. And so basically what that helps the body do is respond from the injection-based treatment. So it's not just about the injection, right? It's also about how your body responds to the injection in order for you to get the best result and outcome possible. So that's all for PRP and prolotherapy. If you have any questions, as always, please give me a call. Also, we appreciate you subscribing to the channel, and please, if you enjoy these videos, please like them. It lets other people know that these videos are of value or could be of value. So I hope that you're doing well. Until next time, signing off, Dr. Brian Anderson.